In the last video, we started off with antimicrobial agents, correct? Also called as AMA. It comes under chemotherapy. Now they have grouped it all under chemotherapy, okay? So you can expect antibiotics here. Antibiotics are natural, but there are a lot of synthetic agents. Hence, they are all together grouped under antimicrobial agents. First, let us see what antibiotics we have seen, okay? We have already seen. So antibiotics are nothing but substances produced by microorganisms which can selectively suppress or kill other microorganisms even if the antibiotic is present in low concentration. Okay, example is penicillin, discovered by Sir Alexander Fleming. Antibiotics can be obtained from bacteria or fungi. Bacteria like actinomycetes will give you aminoglycosides, tetracyclines and chloramphenicol. We have seen the classification by the type of organism it works against. We have seen by the spectrum. We have also seen by the overall action, bacteriostatic or bactericidal. This is the mechanism of action classification. So I think you can pay attention here. Cell wall synthesis is inhibited by penicillin, bacitracin, cycloserine. So the bacteria's cell wall itself is gone means what? Bacteria cannot protect itself, right? So main thing is cell wall synthesis is inhibited by penicillin, cycloserine, bacitracin. Cell membrane leakage causes. These people will cause leakage in the cell membrane. Example bacitracin. Then you have these tetracyclines, chloramphenicol, linezolid. These are all bacteriostatic if you remember. They will inhibit the synthesis of protein in the bacteria. mRNA code misreading, permeability, who will affect? These ones. Streptomycin, gentamicin. These are aminoglycosides. Streptomycin is MY. Gentamicin has MI. These indicate the origin from which organism they have come. So you should be very careful about the spellings, okay? Then DNA gyrase inhibitors, fluoroquinolones, example ciprofloxacin. DNA function interfere, that is rifampicin. Actually, there's more information here. DNA dependent RNA polymerase is inhibited by rifampicin. So this rifampicin actually interrupts RNA synthesis. So there is going to be interference in the work of DNA dependent RNA polymerase, okay? Rifampicin. Rifampicin is used in tuberculosis treatment, so I think it's good if you know more about it. DNA synthesis interferers, you have antiviral drugs like acyclovir-zidovudine, which is used in HIV. Acyclovir-zidovudine. Intermediary metabolism, who will interfere? Sulfonamides. Sulfonamides, what they'll do, actually they will inhibit the folic acid synthesis. When folic acid is not there, the bacteria makes its own folic acid and it needs this fresh folic acid. When this folic acid is not there, it cannot make purines and pyrimidines, hence it cannot make DNA or it cannot make RNA, so it cannot multiply. Okay, so it becomes a bacteriostatic. Okay, let's revise the classification of antimicrobial agents based on the mechanism of action. Inhibition of cell wall by penicillin, bacitracin, leakage of cell membrane by bacitracin, nystatin, harmycin, inhibition of protein synthesis by tetracyclines, chloramphenicol, erythromycin, clindamycin, linezolid, mRNA code misreading and permeability affected by aminoglycosides like streptomycin and gentamicin, DNA gyrase inhibitors, fluoroquinolones, ciprofloxacin, interrupting RNA synthesis by interfering with DNA dependent RNA polymerase, rifampicin, DNA synthesis interferers, antiviral drugs like acyclovir-zidovudine, intermediary metabolism interferers like sulfonamides. Sulfonamides will interfere with what? Folic acid synthesis. Is this much clear, guys? So I think we can close this video, right? Bye bye.